Right now, though, we're going to touch on an interesting phenomenon concerning birth patterns. These numbers are out of the U.S. We're going to find out whether it is true, it's holding true in Canada, that women over 40 are now having more babies than teenagers are having babies, and what is driving this change and what it means really for our healthcare system. We welcome to CJD Dr. Diane Francoeur. She is Executive Director of the Society of Obstetricians and Gynaecologists of Canada. She practices out of the Sainte-Justine Hospital, and she's also a professor at the Université de Montreal. Dr. Francoeur, welcome to CJD.
Good afternoon.
Do the numbers bear up here in Canada as well, that women over 40 as a group are now having more babies than teenagers?
Yes, that's wonderful news. Else than being an OB at Sainte-Justine, I've been taking care of teenagers my whole career. And, when I came back from my fellowship in the U.S., we were at around 50 per 1,000. Now we're less than 4. For us, it's music to my ears because, having a child when you're a teenager, unfortunately, sometimes it means that you will have a miserable life and you're going to stop school unless you have a very, very supporting family, which was not present most of the time. So that's a good idea. So that being said, we see the mom over 40 more and more, and it's not such a bad idea either, because you know that the average age of women having their first baby in Canada is close to 32. That's old.
Yeah, I was kind of shocked when I was pregnant with our firstborn, Kaylee, because her due date was a couple of weeks after my 35th birthday. I was considered a geriatric mother.
Yeah. What a bad term.
Yeah, it's true. I think they call us something else now, that something a bit kinder. But I was considered a geriatric mom, so I understand. I understand kind of this trend. What though do you think fundamentally is driving it? It can't all just be developments in birth control preventing those unwanted pregnancies in teenagehood.
Yeah, first of all, it's let's say the trend is in Canadian patriotism. We do well on that. We've been doing well for a long time, because if you compare, U.S. has always been the worst country in the whole world for teenage pregnancy, most of it for many religious reasons. But here, we've been doing sex education for a long time. We had the nurses being able to prescribe the pills in high school. We have sex education. So, and also we did a lot of representation, so the long-active method like IUD were available for kids that didn't have the money to pay them. So that made a big change. Nevertheless, we know that now teenagers have sex at a later age, which is even better because they are more, confident in themselves and saying no when they don't feel that they're ready to do it. So that's, from the teenage side, it's all good news. Now, the difference between also Canada and the U.S. is that we don't realize it until we go and practice there or go on vacation there, and then you get a big amount of money on your credit card, because the safety net of our healthcare, even if it's not perfect, it does wonder, because women in their 40s here, of course, it's a high-risk pregnancy, but nevertheless, most of our moms do very well because they have access to care. They're going to be able to be followed with any expert that they need if ever they develop the most important complication, which is high blood pressure and what we call preeclampsia, when it goes very bad. But nevertheless, our moms are healthier, and that makes a big change in having a baby or not in your 40s.
Does that mean then that because the outcomes are better for these older mothers, that it doesn't become more of a burden on the healthcare system, having women delaying their childbearing?
Yeah, totally. And it's in Sainte-Justine, obviously, we're a high-risk pregnancy center, so we see a lot of them, and most of them are really healthy. But nevertheless, I think there's still some key issue that women and their partner needs to know. Even if we say that it's okay to have a baby after 40, there's still a lot of miscarriages. So don't wait. Don't wait. Don't try your ovaries because they may fail you. So it's always better to try early on, because we know that the infertility rate after 40 is more important than between 35 and 40. And so that's why I think it's if you didn't have any other choices, it's okay. But if you are planning to have a baby, let's not wait, because infertility is a disease. It touches 15 to 20% of the population, and when women are trying to have a first baby, if you had one before, it's a total different ballgame. But if you try for a first baby, it's really hard, because women really realize that they should have tried before, and then all the guilt. We're very good at that, women, to wear it and stay and stick with it, and so people need to know that, and I think that the good news is that we're talking about women having babies. So what a good way to kill the sadness around the political situation we're living in right now, because, women are worried about the economy, and sometimes this is why they waited. We saw that women waited more during the COVID years before they had a baby, because of all the uncertainty around all the impact that this would have financially on the healthcare system and all around it, and all these decisions.
It is interesting how many elements are factored into the decision to have a child. It's not just your whether you're ready to be a mother. It's do you have a partner? Is your partner ready to be a parent? Or are you going to go it alone? Do you have the money? Do you have a place to live? It seems as though all of these things do conspire in a way to push that decision down the road until you're a little bit older and maybe a little bit more stable in your working life and your community. For example, you have people around you who can help out. It does seem it seems that modern life is pushing women toward delaying the decision, in my view. Perhaps, Doctor, you can disagree.
No, I totally agree with you. And there are some trends that we see, and you just push a sensitive issue, having help, having a family. And on that matter, as a Canadian and as a woman living in Montreal, I've learned a lot for different communities, because, all those poor women coming from every country in the world, they're never alone. They have their family, even if they are thousands of kilometers away. They are with them. They support them. There's always someone gonna come and help them when something bad happens. And I think that we need to learn about that. But going back to the reason why young women delay, there's a new trend that for me is even more scarier. It's young women who decide not to have children because of all the uncertainty in the world, because of war, because of the impact of climate change, and this eco anxiety has an impact on them, and sometimes they change their mind later on when they meet the true love, because sometimes there's also that you can meet a lot of people on your dating app before you find the right person, especially if you don't live in the same country. But nevertheless, we see a trend, and it's there, of having young women coming in their early 20s saying, I don't want a child, I want to have a tubal ligation. And for us, it's always a challenge because we want to make sure that it's their own decision.
And that maybe they don't realize no one likes being told, keep your options open. But sometimes that's the best advice. Keep your options open. Doctor, thank you very much for your time. I appreciate you joining us here on CJ80.